Hi, I'm Dr. Byam. This video goes over using MetaHumans in virtual reality.
I am MetaHuman.
MetaHumans are a really popular digital human that's produced by Epic Games, and programs are working to put these into virtual reality, particularly standalone virtual reality, which can be quite challenging. First, let's compare these to some of the older avatars that we used to use. You can see that these ones are from Character Creator. And besides the resolution, you can see that there are aspects of the character's form that aren't quite realistic. Also, at the time of this, we didn't have a full-time animator, so you can see that the patient itself looks quite rigid and stiff. With all of that said, you'd be surprised once you're in virtual reality. If you compare the experience of watching these characters on YouTube versus going into the headset, you are far more immersed when you're in headset. And often when we get people commenting on resolutions of these older characters, it's when they're watching the videos as opposed to being in. Once you're in the VR headset, you've performed a couple interactions with that digital character, you're typically hooked and quite immersed at that point. And rarely do people comment on the actual resolution once they're outside of those types of virtual scenarios. Here you're seeing one of the MetaHumans that we've integrated into our virtual reality scenarios. You can see off the bat, the resolution is a lot higher and the form more realistic. Our full-time animator, Joshua Brown, has made the animations look very smooth and realistic. This particular application that you're seeing is called MedValley, and it's made for clinical interactions like physical exams. So that's why the patient here is wearing their gym shorts, and you can see that we're prioritizing a bunch of clinical interactions, and you're seeing less of the kind of naturalness and the facial animations that you would see in a person in another type of scenario. So even with all the work to put these MetaHumans into virtual reality, you may notice that they're not exactly lifelike at this stage. If you were to compare something like 360 video, where it's actually live action footage. So anyone considering the use of virtual reality needs to ask themselves what they're trying to accomplish. If you're looking for, from your scenario, a deep emotional response, and the type of scenario or module that you're considering doesn't require much interaction from the learner or variability in the scenario. You don't need different patients rapidly or different user skin tones, those types of things. If that's less important to you, then 360 VR video or some other modality of teaching might be more appropriate. With VR, what you're getting is that added sense of immersion and presence. Additionally, you have the opportunity for more customization and variability and the scaling of the number of scenarios or modules that you may want to add later on. As an example, you can see here, there are several different versions of the MetaHuman that we have available right now in the MedValley application, and it's quite simple for us to go on to Character Creator made by MetaHumans and to import new versions of this and optimize them for VR. Additionally, as I mentioned earlier, virtual reality and other types of modalities like that are more digital allow for more customization of the user, which tends to enhance embodiment. To close, it's pretty incredible what we've been able to accomplish in standalone VR, just as a community in general and ourselves here at SimTec. Lastly, anyone interested in using virtual reality, particularly standalone virtual reality, for some kind of training or educational application, they need to have a discussion with their team to see what are the core things that they're interested in getting out of that. And I suggest talking with a rep. Hopefully one of our reps will be able to help you, because essentially we want it to be a good experience for you and for us and for the VR community. Because if the VR community starts applying VR as a tool to the wrong types of situations and it's a mismatch, it's going to hurt the public image and the progress that VR has made over the last few years.